These are the people that have participated in clinical research. They've made it possible for us to have the new drugs that are available to really improve the outcomes for patients in melanoma. And for me personally, I just find it so inspiring to sit with people that have faced unimaginable challenges in life and that are thriving in spite of it. We'll start maybe on the end closest to me with Ricky, and maybe you guys could each go 2 to 3 minutes and just briefly tell your story. If you chose to participate in a clinical trial, why you might have done that, and just share with the audience what your experience with melanoma has been. And do take the microphone, because it's definitely hard to hear in the back.
Hi, my name is Ricky Morales. I'm a stage 4 cancer survivor. I was diagnosed with melanoma back in 2010, December of 2010. I had a mole on the lower part of my shin on my left leg. I have a good friend that works for a surgeon, and we went forth with the surgery and had it removed. Pathology came back positive for melanoma. I then was referred to Huntsman Cancer Institute, to Dr. Anabaka and his amazing team, where he educated me about melanoma and how severe it was and pretty much what I was dealing with. We then set up surgery, and he went in and he cleared up more margins on the lower part of my shin on the left leg, and he also took 3 lymph nodes out of my growing area and had those biopsied. The skin came out clear, but 1 out of those nodes came back positive for melanoma. So then I was referred to Dr. Ferguson at Intermountain Hospital, and we went forth with plastic surgery. On the lower part of my leg, we did a muscle flap and a skin graft, and that was a rough surgery. I couldn't walk for 3 months. We wanted to make sure everything took properly, so it was really hard recovery. I then went back to Dr. Anabaka to have the lymph node completely removed in the growing area. That was February of 2011, and I believe he removed 12 lymph nodes, and 1 of those lymph nodes was positive for melanoma. So the next chapter was to be referred to Dr. Grossman and his amazing team, and they brought up interferon. And I was very intimidated by interferon. It has 3 pages of severe side effects, which frightened me. My body had been through 5 surgeries. I still couldn't walk properly. I was still really ill and recovering from surgeries, and my body was pretty beat up. So at that time, I chose not to do any kind of severe treatment and went under surveillance for 3 months and blood work. So my next set of scans were June of 2011. And I went back for my scans and met up with Dr. Anabaka, and he let me know that we saw a hot spot in my abdomen, and he wanted to make sure what we were dealing with and had a needle biopsy done on that, and it came back positive for melanoma. So I knew that I would be dealing with another surgery. So went back to Dr. Anabaka, we set up the surgery, and he removed, I think it was 11 lymph nodes, and 1 of those was positive for melanoma and possibility spillage into my abdomen. So I knew then that I had to do something more drastic. So Dr. Anabaka got the plan for me to do radiation, 6 weeks radiation, 30 treatments, Monday through Friday. And to follow would be a clinical study. So that's what was the plan. So we went forth with it, and I don't know if anybody has done radiation before. It's rough. It's rough, and I did it to the pelvic area, so it's just 15, I think it was 15 treatments in. I thought I was doing pretty good, but my skin started to break down, very fatigued. You almost feel zombie-like. You lose the kind of the color out of your skin. You're just tired, and you can't eat properly. It was just really hard. Then we talked about clinical study, and I had missed that clinical study by 2 days. So my nurse oncologist pretty much told me, it is what it is. Let's hope that the radiation did its job. So they pretty much put me back under surveillance for 3 months, blood work, scans every 3 months. So everything seemed to be going pretty well. I felt like my body was starting to heal from everything that it's been through, and I kind of felt my normal being diagnosed with cancer. Life started to get back to normal. So one morning, June 2012, I had woke up and I felt very fatigued and not just tired, and I had a minor headache, and I went to work. Midday through work, I lost my whole train of thought. I felt like I couldn't speak properly. My mind was not right. I continued to stay at work throughout the day, and I went home and I lay down for a couple hours and waited for my husband to get home. And he got home and he began to talk to me. How'd your day go? So I explained to him that I didn't really know what was going on or how I felt. I just knew I didn't feel right. It was like I couldn't get the words out correctly. And he's looking at me like he doesn't know what I'm talking about. I'm not making any sense to him. So he looks at me and he says, I don't understand what you're saying. You're not making sense to me. So he walked down the hallway, and I instantly feel a sensation of the room spinning, but I'm spinning with it. And my body kind of uncontrollably starts to shake, and I fall to the ground. At that point, I knew something wasn't right. And my husband comes running into the room, and he's freaking out, but I cannot communicate with him. I can't say one word to him. I'm laying on the floor, and I'm just shaking. And I know he's calling 911. And the episodes it just left me just like that. It was gone. And I get up, and I go to the room, and he's like, what are you doing? I said, oh, I'm getting ready. He goes, what are you getting ready for? I go, I'm getting ready to go to the ambulance, with the ambulance. So he's like, please come sit down, sit down. You're scaring me, just sit down. So I do, I sit down, and the ambulance gets there, and they're asking me my medical history. I let them know that I've been diagnosed with melanoma. I see a fear in one of the gentleman's eyes, like he knows he's been touched with it, or somebody around him he's been touched with. So at that moment, I start to feel that sensation again, and I start to uncontrollably shake. You try to fight it, but you can't fight it, but you're trying to. And I hear the ambulance saying, the paramedics are saying, well, she's got some funny kind of twitch. She's twitching. And they're like, we've never seen anything like this before. She's twitching. So I knew at that point we were going to, in the ambulance, and they asked me where I wanted to go, and I said I wanted to go to Huntsman. And they told me, no, we can't take you to Huntsman, but we'll take you wherever else you want to go. So I told them Jordan Valley, which was close to my house. I went in there. I met the physician there, and he talked to me, and the paramedics had told him that I had some kind of funny twitch. So he asked me my medical history, and I told him that I had been diagnosed with melanoma. And I instantly saw the fear in his eyes. So he tells me, well, we're going to put you in a MRI and a chest scan, CT scan. So I said, okay, and then instantly I feel that sensation come back, and I start to shake uncontrollably. I can't help it. And he said, well, you're not having twitches, you're having seizures. This is a seizure you're having. So I instantly feel like he sedated me. So the whole night is kind of touch and go, but he throws me into a scan, and fastest scan I've ever been in. I mean, it was really fast, and they got the results really fast. And he comes back and he tells me, you have brain metastases. You have one sitting right on your memory and your speech area that's bleeding, and then you have two smaller ones in the front of your lobe. I think for a cancer patient, that's our worst fear, is brain mets, because you don't really know if there's life after brain mets. So it was a hard pill to swallow for me. For, I think, all of us, it was hard. So then they transferred me up to the U of U hospital, where I met the physician on duty there. I had all my friends and family around me, but it was like they were looking at me like I wasn't making sense. And it was frustrating. So the doctor explains that where the brain tumor is sitting, it's over my memory and my speech, so I can think everything correctly. But when I speak it, it just doesn't come out right. It doesn't sound right. So, which made sense to all of us. So, like I said, that first night, it was just kind of touch and go. I didn't really remember a whole lot of it. I was sedated. They would ask me questions, like I wouldn't know my husband's name, things like that. So it was, that first night was very, very rough. The next day, Dr. Grossman had come in, and he had looked at me, and I had saw that he was upset, and he tells me, well, Ricky, you're stage 4 cancer now, and your statistics are probably 12% chance of survival. And I was so mad at him for telling me that. I was so angry, but I knew somebody had to tell me, but it actually made me fight more. It fueled my fire. It made me want to take this on and just take it on everything I can do. So he told me that he was going to get a plan going for me, and he would come back and approach me with the plan. He let me know that the neurologist wasn't sure if he wanted to do surgery because where the tumor was sitting, they were afraid that it would mess with my memory and my speech. So he left me like that. And, I just took it as what it was. And the next day he came to visit me again, and he said, well, we have a plan. I said, where's the pen and paper? I'm ready to sign away. What's the plan? He said, okay, well, we're going to do brain surgery. We're going to follow with brain radiation. They talked about SRS brain radiation and chemotherapy. So I said, okay, let's go. I'm ready. I definitely was in fighting mode, and I was ready to take on this beast. So June 15, 2012, I had brain surgery. And surprisingly, that surgery was so easy compared to my other surgeries. I did not think it would be so easy, but the recovery went really well, and I was happy with that. And July 13th, Friday the 13th, I did brain SRS radiation. which wasn't so bad. It's a little frightening. You're kind of put on a table and strapped to it, and it's just, you never feel like you can do stuff until you have no choice but to do it and have the courage to do it. So I took it on and got that out of the way and was left with a really cool Halloween mask that I bring out every year as a prop. So that was good. And the next, I think it was 2 weeks later, I met with Dr. Grossman and his team, and he gave me a few options on chemotherapies, and he brought up biochemotherapy. So I was just so ready. I was ready for anything he was going to give me at that point. And he started talking about it, and I said, let's do it. Let's do it. I'm ready. So he said, okay, let's get it going. So I had to do a few tests to make sure my body was strong enough. He wanted to make sure my heart was strong enough and my lungs were strong enough for this treatment. Everything turned out great. So they called me on a Friday and said, we'll see you on Monday for chemotherapy. So I said, okay. And how biochemo works is you're in the hospital 5 to 6 days, and then they send you home for 2 weeks. And then you're back at the hospital for 5 to 6 days. And then they send you home for 2 weeks. And then you're back at the hospital 5 to 6 days. And then they send you home. My plan was for 3 cycles. So I checked in on that first day, and chemo started. And, they hook you up with IL-2, low dose. You're on that for 24 hours for 5 days straight. You get injections of interferon, which I never wanted to do, and cisplatinum is the chemo part, vinblastine, and there's another one, dexoximar or something like that. And that treatment was not easy, not easy at all. I was very sick. I had every side effect you could think of with that treatment. The IL-2, you fill up with fluid, your skin turns to fire. I hallucinated on it, night terrors. It's just nasty, nasty treatments. But I had made it, and I did everything my doctors wanted me to do. They told me, if you walk the halls, the chemo can go through your body faster. So I did everything that they wanted me to do, to make it easier on me. So on the 5th day, they sent me home, and you're sick as a dog. You have no strength to get out of bed. You have no strength to do nothing. You can't eat. It's miserable. You're just almost to death, it feels like. And it's like right before you have to go back for your second cycle, you just barely start feeling better, and you have to go back to it. So I checked in for my second cycle with biochemo, and I felt from the get-go on my second cycle that my body was pretty beat up. It was pretty tired. From the moment they gave me my first injection of IL-2, I was nauseated and I was sick, and it just hit me so hard on my second cycle. It was really hard. I struggled that whole week. I had every side effect, every problem you could think of, I had it. I couldn't get ahead of it. I couldn't get the nauseation it was just out of control. But Huntsman is amazing, and they took very good care of me. So then I finished my second cycle, and they sent me home, and I was sicker than ever that round, and I just didn't feel the same as I did the first round. It was just really hard to recover from that. They had did some blood work on me to check my counts, and my white blood cells and my red blood cells and my platelets were extremely low. They brought me back in for my third cycle, and they put my PICC line in and took some blood and realized that my counts were so low that if I continue with the chemo, that it would kill me. So Dr. Grossman then chose not to do chemo for me that day and postponed chemo for a week. They kept track of my blood counts that would still not come up. We were still struggling to get them up. They were not coming up. So Dr. Grossman had read about a patient that had the same situation as me, and they had did a bone marrow aspiration biopsy test, and that patient had came back positive for melanoma in their bone marrow. So I knew that he would want to do that on me. So that was the next plan. He had me do the bone marrow aspiration biopsy test, and he had a fellow do it for me. And I'm still so mad at him for that procedure. That procedure was very rough, and I wish he would have sedated me because it was really rough. And the hard part is when they're trying to take the bone sample and he can't get it, and he's just pulling and pulling and pulling. And I'm screaming at the top of my lungs, and I'm looking at my husband, and he's crying, and the nurse are pinning me down. It was bad. So I knew everybody had heard me in the office, because as I walked out of there, they're looking at me like, "Are you okay? Is everything okay?" So the good news is that came back negative. I had no melanoma in my bone marrow, so that was a great day. That was the first time I ever had really good results from anything. So what had happened is we waited another week to see if my body would start to recover, and it still wasn't recovering. So Carolyn, my nurse oncologist, had came to me, and she told me, "Well, Ricky, no more chemo. Your body's telling us that it's tired, it's had enough, so we'll take it as is, and see what happens, and your body's pretty tired, and we're just gonna send you home to recover." And I was okay with it. I felt a sense of peace with it. I think a lot of us cancer patients, when they told us when we can't follow through with the treatment, it's frustrating, because you want to follow through and you want to battle and you want to win this. But I think at this point I was okay with just doing the 3 cycles of that regiment. So that's what happened. And the only really bad severe side effects I have right now is just lymphedema in my left leg. I've been no sign of disease for over 4 years now. Life is amazing and a blessing, and I don't take any day granted at all. And I just have to thank my amazing doctors. They're just wonderful people, and I owe them my life. Thank you so much.
Ricky, that was absolutely touching. I don't think there's a person in this room who's not a little bit teared up right now. And but I just the other thing I'm just noticing as I'm looking around the audience while you talk is there are so many other people here that have experienced similar things, and I think for them to hear what you just said is an incredibly uplifting thing. I'm going to jump a few people, because there are lots of amazing stories here. And I'm going to try and grab a few highlights from a few of our other patients, one of whom is on the end there. David, if you could tell me just a little bit about your decision to do adjuvant therapy and what it's been like on ipilimumab.
Is this on? All right. So my story is not nearly so long or detailed. I started ipilimumab just over a year ago. And I had been completely healthy. I'm 29, and I was like, man, what an awful time to. Usually, only old people get melanoma and skin cancer after you've been exposed to the sun for lots of years. People from the 50s never wore sunscreen, so obviously they're going to get it. I've been a sunscreen just militant my whole life because I'm really white, and so we've always known about that. My dad's had lots of moles taken off. I've had tons of moles taken off, but finally one of them tested positive. So they decided to put me on the ipilimumab, and we were about to do the other one. I forget what it's called, interferon. Mm-hmm. And I was like, oh, that sounds really awful. And so I tried to avoid that one, and luckily they let me do the ipilimumab, and it's been really easy. Like, I've been able to work, I've been able to run and do sports and do all the things I normally like to do, so it's been a really positive experience. And I get 1 day off every 3 months to come and sit and watch TV and talk to the nice doctors and nurses, and then I get to go home and I don't have to go back to work. And so far my experience has been really, really positive. My last dose will be in February, and all my scans up to this point have been clean, and it's been really positive and exciting. It's really nervous when you're talking to them the first time and they're telling you your % chance of death, and you're like, I could die. Like, I'm only in my late 20s. Like, that's not supposed to be a conversation you have until you're like 80s or 90s. So it was kind of scary at the beginning. I mistakenly told a girl I was about to date at the time that I had this cancer and I could die, and she soon broke up with me after that and didn't want to continue dating me. So I learned my lesson real fast, not to bring it up. But after that, the experience has been really positive, and obviously the Huntsman Cancer Center has been a phenomenal place, and they actually are curing right now my cousin of bone cancer, so I just can't say enough about the Huntsman and the experience that they have, and it's so positive to see all the other people that have gone through things probably much worse than I have. I think I got the easy end of it. I had stage 3A, I think, early stage 3. And so there's like, ooh, that's not stage 1 or 2. That's in the later stages. Like, oh man, maybe we caught it too late, but it's turned out to be really positive. And overall, like, I really have nothing terrible to say. Now, there's still a few scans left, so we don't know. But I think overall, like, it's gone really positive. So I don't know. I figure that's why they brought me here, because it's like, hey, here's a success story we've had so far. Like, hardly any side effects, maybe some fatigue, and I have a lot of itching. It's like a million mosquitoes biting you all over your body. But it doesn't last very long, and it's only when you get really embarrassed or your blood temperature, or your body temperature rises too fast. So other than that, it's been really positive. I don't know. Is that pretty much what
That's
you were looking
perfect.
for?
I mean, we couldn't ask for a more glowing personality and good dating advice. So, no, it's a terrific story. I'm gonna ask that maybe Carly say a few words, because she's been with us for a while, and I want you to tell about your experiences with your treatment.
Okay, I've also had very positive experience with the Huntsman. Mine started in 2011, and I had surgery with my dermatologist, and then was clear for 3 years and found a lymph node that was swollen in my axilla and in my by my clavicle. And so I came up here and we did the needle biopsy, and right away started the ipilimumab, which I also had great success with. I was stable for a long time, and then so we just did scans for a while and decided to just wait. And then in, January of 2015, then I discussed with my doctors, and we decided to do some further treatment. So I actually did the TVEC injections, and we did the ultrasound-guided injections directly into my lymph nodes, which was really interesting to see, because you could see it every 2 weeks. I would get to see my lymph node and the how it was decreasing. So that was a really interesting experience. Also, very few side effects. I felt really lucky to not have too many things go on. And it's been a full year since I've had any treatment, and 9 months since I've been considered a complete response. So I also had very positive experience, and I'm very thankful for my doctors as well. So.
That's a great story. And Davis, I'm going to save you for last, because I want to pick on Diane here a little bit. So Diane has a very long story with melanoma. We've known each other for a lot of years now, absolutely. But something happened during your care that I think is something that a lot of the people in the room sort of fear when they participate in clinical research. You were randomized to an arm of a trial that neither of us felt was as exciting as the experimental arm. And if you could just share with the group what that was like and how you soldiered through it, and what life has been like following that particular turn in the road.
Sure. I was diagnosed with stage 4 melanoma 4 years ago. I'm sorry, this is emotional. It was mets to my brain, lung, small bowel, adrenal gland, and I had one under the skin is actually how we found it. The prognosis was not good, but I knew I had faith and hope that if I could make it 2 years with all the research and clinical trials, they would have more treatments for me, and they did. I've been through IL-2, 6 weeks of IL-2, which is the same, you're in the ICU for 6 weeks. It's a wild ride. I've had stereotactic radiation to the brain, 15 days of radiation, 4 IPI treatments, 9 rounds of chemotherapy. And that's what Dr. Grossman was talking about. I was randomized in a clinical trial, and it was either Keytruda or chemotherapy, and I drew the arm of chemotherapy, which you're like, I didn't want that. But we forged ahead, and I had 9 rounds and actually had positive results from the chemotherapy. So that was really good, and really, that's why it's so important to participate in clinical trials, because even if you don't get the newest, greatest drug, you can still have success with what's out there. So then I was on the combo, the IPI-Nivo combo just recently. Now I'm on just IPI. I've had SBRT radiation to my lung, just got finished with that. And so I'm 4 tumors less than I was when I started. Thanks to Dr. Grossman and the Huntsman. I tell my friends he's wicked smart.
Thank you. I appreciate your sharing your story. And we have one last patient, certainly not least, Davis Moore. Davis, I've perhaps known you longer than anyone on the panel here. You were one of the first patients I got started treating when I became an oncologist. And we've had a lot of years together, certainly been down the road many miles. And if you could kind of talk about the most recent chapter of therapy you've been on.
Yeah. So my most recent chapter, originally my melanoma, I had a pretty big tumor load. I had brain tumors and lung mets and abdominal masses and neck things and things like that. But toward the end, it seemed like the treatments all were cumulative, and I didn't see results with IL-2, high dose IL-2. But then when I did IPI right after it, I got a pretty good result, and I felt like the treatment actually was better because of those primary treatments. My last treatment was with T-VEC, and then before that, it was with a cold virus that they actually injected in the tumor. And with T-VEC, we saw a pretty good result. And the tumor basically, we treated it for about a year, and it basically was dead. We finally removed it at the end, and there was a bit that was still alive, but we thought that maybe the needle wasn't getting to that part, and that's why it may have survived. But since that time in February, I have not had any other tumors, and so for the longest time in my life, I've been tumor-free, which has been fantastic. And the side effects were, I didn't even have a side effect with T-VEC. I was kind of worried that I didn't have a side effect. I wanted a side effect. Because the other ones, I had a lot of side effects. But yeah, it was really nice. And I worked with Dr. Grossman and Dr. Anabaka. So if you guys work with either of those two guys, they and their teams are fantastic. I got calls on the weekend, so I knew that they were thinking about me all the time. And they talked to me about treatments, and then after they talked to me about it, they come back to me with phone calls saying, you know, I've decided to do this and this. What do you think? Because I've been thinking about this and this. And I thought, wow, these guys are thinking about me all the time. They really care about me. So fantastic teams, fantastic people.
Mm-hmm. Thank you for that. I just want to say a final thanks to this panel of folks. One of the things that I'm really hopeful comes out of today is that the patients in this audience find each other. There really is nothing more valuable than someone who's been a few miles down the road ahead of you. And they can talk, I think, very frankly about what those experiences are like, what it's meant to them personally. You know, if I were a patient in this room, I wouldn't hesitate for a second to come to any of these people and say, hey, how'd you get through this? You know, what are your secrets? So thank you.